It's been about 2 weeks since the Vermont General Assembly adjourned, and the staff of the Vermont Medical Society and its physician leaders can all breathe a sigh of relief that we were able to stop many provisions that would have harmed the physician-patient relationship and actually get positive legislation enacted. This week's legislative wrap-up will provide detailed information about a dozen pieces of legislation that impact your practices. Most importantly, we were able to stop a tax on independent physicians, prevent a private right of action for HIPAA violations, have reasonable guidelines around prescribing opioids, and work with others to prevent the legalization of recreational marijuana. While it was a difficult year, it was very successful in helping physicians continue to treat their patients here in the state of Vermont.
S-243, the opioid bill, came out much better than it began in the legislature. Opioid misuse and addiction is a public health crisis in Vermont and nationally, as VMS members know, and a high priority for VMS. This year, the VMS created a multidisciplinary opioid task force with more than 40 members. Throughout the legislative process, VMS members and the opioid task force testified and communicated with legislators, and the final result was a bill that VMS could support. The bill that passed requires any changes to the requirements to check the Vermont prescription monitoring system and any limits on prescribing, either dose or time, to be addressed by the Department of Health in a rulemaking process, and requires the department to include a robust consultation process, including with the VMS opioid task force. The rules must also be evidence-informed. The bill increases the CME requirement for prescribers with DEA registration from 1 hour to 2 hours every 2 years, addressing various aspects of prescribing of opioid-controlled substances. VMS will ensure that CME options to fill this new requirement are readily available. The bill also increases funding for the UVM Academic Detailing Program and provides new funding for a statewide drug disposal program and a public information campaign on safe disposal and responsible use of opioids. The public information campaign was a high priority of the opioid task force. There's more work to be done on this issue, and the VMS opioid task force will work with Commissioner of Health on rulemaking this summer and fall.
The effort to legalize marijuana this year took many twists and turns, and it was a bit of a roller coaster ride, but in the end, no legislation passed, and the Joint Committee on Justice will be looking at issues regarding legalization of marijuana this summer and fall, and we will certainly be following those committee meetings. A big thank you to all of our members who contacted their representatives and senators this year, especially Drs. Joe Reinhardt, John Porter, Dave Vertu, and John Hughes. As everyone knows, it's an election year and it's the last year of a legislative biennium this year, so there'll be lots of changes up at the State House, and so I encourage members to get to know your candidates and see where they stand on the issues that are important to you.